Oh, thank you very much. I would like to invite the next speaker, Dr. Lee Ja-sung. His title is Clinical Experience of Ultrasound-Guided HIFU Treatment for Gynecologic Disorders at the Single Center in South Korea. Next slide, please. Yeah. He the first HIFU doctor in obstetrics and gynecology of South Korea, and participated in Congress as a lecturer. For example, the first Young International Summit of Minimally Invasive and Non-Invasive Medicine. And he had published ultrasound-guided HIFU intensity focused ultrasound treatment for uterine fibroid and adenomyosis, a single center experience for the Republic of Korea. And he had so many papers, and he's one of the leader of Korean gynecologist, and he has many experience in HIFU treatment. So we are going to invite him to give us a lecture. Professor Dr. Song, please.
Thank you. Good evening, sir. Hello, nice to meet you. I am Seong Lee from South Korea. I am the first Chungching HIFU doctor of Korea and the first gynecologist HIFU doctor in Korea. I have treated uterine fibroid and adenomyosis by HIFU during 13 years, from 2010, and now I have treated about 2,900 HIFU cases. I have used JC and JC effective model for HIFU treatment. I hope my experience of HIFU may help you take care of your patient in your hospital or in your clinics. I will present 13 years my HIFU experience. As you know, 3 effects against the tumor cell by treatment with HIFU appears. The first, direct thermal ablation. The second, cavitation effect, destroying tumor cell by increasing cytoplasm temperature. The third, damage to tumor nursing blood capillary, coagulation necrosis. This is the record I requested of the Ministry of Health and Welfare in June 2012 for HIFU permission for uterine disease. This is issued in Korea in February 2013. After that, many doctors and hospitals have started HIFU treatment. This paper for my HIFU story. Until this year, I have reported some papers of HIFU treatment. Demographic data of uterine fibroid and adenomyosis. Average age was 41 and average treatment time is 80 minutes. This paper, Journal of Ultrasound and Sonochemistry in 2015. The second paper was Journal of Ultrasound in Medicine and Biology in 2019. This table is a follow-up result of the post-HIFU treatment in uterine fibroid. The total of 918 fibroid was treated. Uterine fibroid volume reduction rate were 55, 63, 74% at 3, 6, and 12 months respectively. Decreasing symptom severity score scale and increasing the uterine fibroid symptom and quality of life was statistically significant. The figure was shown. Total of 889 adenomyosis was treated. The uterine volume reduction rate were 45, 51, and 60% at 3, 6, and 12 months respectively. Decreasing symptom severity score scale and increasing the uterine fibroid symptom and the quality of life was statistically significant. The volume reduction rate was somewhat lower than uterine fibroid. I think that The reason why adenomyosis reduction rate is lower than myoma is the measurement of total uterine volume. In cases of adenomyosis, because I did measure the total uterine volume, the patient with adenomyosis have more severe symptoms such as menorrhagia and dysmenorrhea. They are more satisfied with the dramatic result after HIFU treatment. Here I prepared some example case of HIFU. 7 centimeter case of submucosal uterine fibroid was shown. Non-perfusion area was seen inside the boundaries of the tumor. After treatment in enhanced T1 weighted MRI image. After 7 months later, necrotic lesion of myoma was disappeared in the uterus. No more myoma was observed in this MRI image. In cases of HIFU of uterine fibroid, complete ablation close to the capsule of myoma would be reduce the relapse rate. This case is a 5 centimeter case of multiple uterine fibroid. 9 months later, the volume of myoma was reduced by 88%, and there was no regrowing on the margin or no relapse. 34 months later, after treatment, necrotic lesion of myoma was expulsed out of uterus. No more myoma was observed in this figure. This is another submucosal myoma HIFU treatment case. Necrotic lesion by HIFU disappeared in 3 years follow-up MRI image. Submucosal type of myoma is one of the best cases for HIFU treatment. This case is a cervical myoma. The cervical myoma was growing at high vascularity site of uterus, and its nature is very soft. So, HIFU treatment of cervical myoma is somewhat difficult, and the recurrence rate is more higher. First time, this patient received HIFU at another clinics. The uterine fibroid was located uterine cervix. Previous HIFU treatment was incomplete. I used GnRH agonist for 3 months before HIFU, and then lesion over 90% was treated. After 6 months later, lesion was decreased to 2.5 centimeter size lesion, about 90-70% decrease. Some cases of rapid decreasing size was related to infection of lesion. If infection occur in HIFU lesion was more friable and easily detached, like pus and discharge. If you suspect infection, antibiotic treatment was needed until symptoms disappeared. HIFU can be non-surgical myomectomy and non-surgical adenomyomectomy, I think. This case was multiple fibroid. The size of uterine fibroid varied widely, and there were more than 20 in the uterus. For the best treatment with multiple uterine fibroid, important point is making type 1 myoma by pre-medication like GnRH agonist. Type 1 fibroid were easily treated by diffusion energy or cavitation effect. If you meet patients like these cases, I recommend that you use GnRH agonist about 2 or 3 months before HIFU. And then if cooling time is over 2 or 3 seconds and the total treatment time get enough, sufficient cavitation effect can be given to all myomas. This case is 8 centimeter adenomyosis cases. She had 2 babies. I treated the entire lesion except the safe uterine margin near the bowel. 42 months later, uterine volume was decreased to 82%. She feels very good well. Severe menorrhagia and dysmenorrhea was disappeared. 12 centimeter diffuse huge adenomyosis cases. She received 3 times of in vitro fertilization for pregnancy. Superovulation injection made adenomyosis worse. I treated near entire lesion. Uterine volume was reduced by 87%. HIFU treatment for adenomyosis is the best non-invasive treatment of choice, except hysterectomy. This combined case is a submucosal myoma and diffuse adenomyosis case. She had diabetes mellitus and her hemoglobin level is 7. Past he have 2 times myomectomy history. Level node gestational IUD was inserted in uterine cavity, Mirena. Submucosal myoma and diffuse adenomyosis was shown. Usually, most gynecologists treat by hysterectomy like these cases. I think that HIFU treatment can be a good treatment modality for this case. After 9 months later, myoma was disappeared, uterine size was normalized. Menorrhagia and dysmenorrhea symptoms were totally disappeared. HIFU treatment could be non-surgical myomectomy and non-surgical adenomyomectomy. I'm really emphasizing. She had huge multiple uterine fibroid over 7 cm, 6 cm, 5 cm size multiple. Because of multiple myoma, uterus was enlarged to 14 cm length. I treated over 90 to 95% of uterine fibroid. T1 weighted MRI image shows well-treated state. 15 months later, she was embarrassed because hysterectomy was recommended by a large hospital of medical university. So she came to me. I recommend her enhanced MRI. 14 cm size uterus decreased 7, and all treated myoma was non-enhanced stated and no new lesion. It was a very good post-HIFU treatment follow-up state. Usually, most gynecologists use diagnostic sonography, but they didn't figure out post-HIFU treatment state. Therefore, even if the treatment is well treated, hysterectomy is recommended only by looking at the shape of the uterine ultrasound image. All obstetrics and gynecologists should know that the treatment state of a patient who received HIFU treatment can only be judged by examining the enhanced MRI image. This slide is a complication analysis for 1,807 patients. 918 cases of uterine fibroid, symptom recur of 42, new lesion of 23, secondary HIFU treatment of 9, hysterectomy of 13, myomectomy of 8. 889 cases of adenomyosis, symptom recur of 39, new lesion of 17, secondary HIFU treatment of 17, hysterectomy of 20. Complication analysis. Transient foot drop of 1, and tumor-rise syndrome and pre-renal failure of 1, small bowel perforation of 2. In case of a transient foot drop and a small bowel perforation, I believe that mistake, for example, power control or interpretation of ultrasound image were made. The rest complication, first degree burn and second degree burn and transient hematria was transient and minimal severe. This paper published in 2018. Journal is Clinical and Experimental Obstetrics and Gynecology. This paper is unintended pregnancy with term delivery following ultrasound guide HIFU ablation of uterine fibroid and adenomyosis. 2017, British Journal of Obstetrics and Gynecology. I checked anti-Mullerian hormone biomarker for ovarian reserve before and after HIFU treatment. there was no significant difference in anti-Mullerian hormone level between the two time point. So we conclude that HIFU treatment do not affect ovarian function. This slide is a HIFU treatment for placenta accreta. I experienced 2 cases of retained placenta accreta. She had vaginal bleeding for 6 months after cesarean section. Ultrasound images show 2 or 3 centimeter mass-like myoma. With HIFU treatment, retained placenta lesion was disappeared after 3 months. Previously, I reported HIFU treatment cases report with retained placenta. In 2016, this is a Journal of Obstetric and Gynecologic Science. This is another treatment cases of retained placenta with HIFU. Incomplete abortion bleeding occur after in vitro fertilization. Dilatation and curettage was performed 2 times, but there was continuous severe bleeding. Placenta invade the anterior myometrium of uterus. Complete ablation was done for region by HIFU. After 1 month later, beta HCG level was normalized at 1 month. This is abdominal wall endometriosis treatment cases by HIFU. I experienced 2 cases of abdominal wall endometriosis treatment by HIFU. This is the first case. She had a tender nodule by menstrual cycle after laparoscopy. After HIFU treatment, the symptom was subsided. This is a Journal of Gynecological Endocrinology. Abdominal wall endometriosis treatment by HIFU ablation. The last topic is effect of a paracervical block before ultrasound guide HIFU treatment in uterine fibroid and adenomyosis. This study shows that paracervical block before ultrasound guide HIFU treatment was a cost-effective method because it helped reduce the total treatment time, ablation time, and the total energy. Also, can be helpful for reducing the excessive use of intravenous sedation. This paper will be published within this year. HIFU treatment with very good therapeutic effect and acceptable side effect for uterine fibroid and adenomyosis and other solid gynecologic disease is the best non-invasive treatment so far. But be careful for patients who want a future pregnancy and informed some possibility of being in trouble of pregnancy. Enough experience are needed to make a satisfactory treatment outcome. We have to approach carefully because treatment cases are all different density and different location each other, and the treatment time and the power level are all different. I really appreciate your attention. I hope my experience might help you. Thank you.
Oh, thank you very much for your beautiful and kind presentation based on your experience, more than 2,000 cases. And I admire you publishing papers, your experiences, and congratulate on your success of publications.
Thank you.
And now it is open to discussion. And if anyone,
I have a question.
First, Dr. Chan.
Dr. Chan.
Yeah.
Actually, I have 3 questions. I also have the HIFU case. The first one, how do you, how about the energy setting in different cases? The first one, the energy setting, the first. The second question is actually you have the first degree burn about 17 case, and the second degree burn about 18 case. The patient, how do you deal with this burn case? The third one, you ever mentioned about abortion after 2 times abortion operation, but the patient also have a lot of vaginal bleeding. You use the HIFU to treat it, and no more bleeding. But I have one, the question is, this case after HIFU treatment, have a baby or not? It's my 3 questions. Yeah.
The first I use the HIFU treatment power level is
Energy setting.
energy setting is JC 200D I used. I usually at least 350 over, and usually 400 power joule. Okay.
Okay. How many time? How long you spend for each patient, especially the big myoma?
In many cases, I treated at 40 minutes and 90 minutes.
Okay.
It's different case and multiple case and single case, solid case is very different. And more huge sizes need to more time.
More time, right?
Time, okay.
Yeah, okay. The second one about your burn case, how do you deal with it after the HIFU treatment? The burn,
Pardon?
the skin burn.
Skin burn.
Yeah.
Many cases is the first degree burn is only dressing or 2 or 3 days, and after then and dry the skin. If we use we do not another medication, and I have no 3rd degree burn, and first and second degree burn case easily treated and only dressing. Okay.
Only dressing.
Only dressing, and for prophylactic antibiotics 5 days.
Okay, 5 days. How about the abortion case? The abortion case that you yes, you have ever mentioned about abortion. After abortion, have the vaginal bleeding, but you use the HIFU to treat it. I say the case. I am adopted like the case have before have a baby after HIFU.
A correct case or post HIFU pregnancy and pasteurization?
In that case, you ever mention about abortion case? After abortion, the patient all are still vaginal bleeding. So you use the HIFU to treat it. The patient have no more bleeding. But my question is, this case have baby or not after HIFU?
I think that the before treatment lesion of myoma or adenomyosis affect the post-HIFU treatment and pregnancy. We can only ablation the myoma or adenomyosis region, but before treatment, the region was very severe. After HIFU, the pregnancy is not good. But if the region is not severe or only a single or some multiple, but some multiple is not severe, we treated HIFU after 3 can pregnant. I think that HIFU after HIFU treatment pregnancy is better than laparotomy, myomectomy. Okay.
Thank you for your answer. Thank you. and thank you for your excellent experience.
Thank you.
Oh, okay. Yeah, Dr. Lee. Yeah, your talk is interesting and instructive and provoking, and I want to ask many questions, but time is limited. Maybe I ask you two. One is pregnancy. After HIFU treatment, patient in case of pregnant, maybe in surgery, after surgery, cesarean delivery, but in HIFU case, how about the cesarean rate? Type of delivery, vaginal delivery or cesarean?
After HIFU treatment, I offer to cesarean section to patient, but he want to normal delivery. Be careful if the risk of uterine rupture. You should receive the cesarean section. Okay.
Oh, so you recommend cesarean, but
Cesarean section.
in some case, vaginal delivery. Oh,
yes.
Okay, I understand. And you sometimes use GnRH agonist. GnRH agonist treatment. In some case, you presented GnRH hormone.
GnRH hormone.
Yeah. How do you select patient? Fusion or in some case?
In cases of myoma and adenomyosis over than 10 or 12 centimeter size, I recommend 2 or 3 months I use the GnRH agonist. But less than 8 centimeter of myoma, I recommend only one use of a GnRH agonist. And we can choose the treatment time is good post-menstrual state. Pre-menstrual state is she has more edematous and uterine fibroid more edematous is not good to HIFU.
Okay. Thank you very much.
Maybe
it's time to move next talk. So thank you, Dr. Lee.
Thank you. Dr. Chang asked from the case who raised your the placenta case I experienced. The both case I didn't admission a chemotherapy to her, but if the HCG level reduction is insufficient, less than 5 after this placenta, we should consider chemotherapy such as methotrexate in addition. Okay.
Thank you for answering another question. Thank you very much.